The ER looks messy from the outside, but there's a reason for every beep, shout, and hurried step. Here are 10 things the ER rarely tells its patients. Organized chaos. Ever walked into an emergency room and thought, what on earth is going on here? Alarms are blaring, phones are ringing, and people are rushing in every direction like it's the end of the world. But here's the thing, it only looks chaotic. Behind that madness is a system so practiced that every move, every shout, every beeping monitor actually means something. Nurses and doctors train for this rhythm until it's pure muscle memory. Beds are swapped, charts are updated, and patients are moved through like pieces in a living puzzle. It's not confusion, it's coordination under pressure. And when something serious happens, like a cardiac arrest or trauma case, that chaos instantly transforms. Suddenly, everyone's in position, and the team moves as one. What feels like mayhem to you is just another heartbeat to them. Triage rules everything. Before you rush into the emergency room thinking you'll be seen right away, here's a little reality check. Hospitals don't go by first come, first served. Sorry to break it to you, but that's not how the ER works. It's all about triage. When you arrive, a nurse will quickly take your vital signs and ask a few brief questions. They're not being nosy. They're figuring out how close you are to real danger. Someone with chest pain or breathing trouble jumps ahead of the person with a twisted ankle, no matter who got there first. This system might feel unfair when you're sitting there waiting, but it's what keeps people alive. If triage didn't exist, the waiting room would turn into chaos, and the sickest patients might not make it in time. So next time someone who came in after you gets called first, don't take it personally. They're just in more trouble than you are. The golden hour. Doctors and trauma nurses often talk about something called the golden hour. It's not just a catchy phrase, it's the most critical 60 minutes after a serious injury. What happens during that short window can decide whether someone survives or not. You see, when a person suffers major trauma, like a car crash or a gunshot wound, their body starts to shut down fast. Blood loss, shock, and organ failure don't wait around. The quicker the bleeding is stopped, the airway is cleared, and the heart is stabilized, the better the chances of survival. Studies have even shown that patients treated properly within the first hour have about a 25% higher chance of making it. That's why emergency teams train to move fast. From tourniquets and chest seals to pressure bandages, they know exactly what to grab and what to do first. And here's the thing, the golden hour doesn't start when the ambulance arrives. It starts the moment the injury happens. That's why training and being prepared aren't just for professionals anymore. Whether you're a medic, a cop, or just someone who wants to be ready, knowing how to act in those first few minutes could literally save a life. Food for thought. Next time you think someone else will handle it. Not all emergencies look like emergencies. This might surprise you, but not every person who walks into the ER looks like they're in danger. Some patients arrive pale, sweating, and clearly struggling. Those are the obvious ones. But then there are others who stroll in, chatting like nothing's wrong, and they're often the ones in the most trouble. Heart attacks, strokes, and internal bleeding don't always come with dramatic pain or visible panic. Sometimes the person is calm, even smiling, while their body is quietly shutting down. Many people convince themselves it's probably nothing until it suddenly becomes life-threatening. That's why ER staff don't just go by appearances. They pay close attention to symptoms, vital signs, and medical history to catch what the eye might miss. So if you ever feel off, don't shrug it off. Speak up before it turns into something far worse. Some patients come for non-medical reasons. You might think everyone in a hospital bed is there because something went wrong with their health, but that's not always the case. Nurses will tell you that a surprising number of patients come to the ER for reasons that have nothing to do with true medical emergencies. Some show up because they don't have a family doctor, some because they're seeking medication, and others because they simply have nowhere else to go. This puts nurses and doctors in a tough spot. They want to help, and they do, but compassion alone can't create more time, space, or staff. When people come in for non-urgent reasons, it clogs up the system and slows care for those who genuinely need immediate help. So the next time you think about heading to the ER for something small, take a moment to think it through. You might just be taking the bed meant for someone whose life depends on it. Trauma teams work like a machine. When a major trauma case rolls through those ER doors, what follows may look like pure madness, but it's anything but. Everyone on that team has a job, and they perform it like clockwork. One person secures the airway, another controls the bleeding, someone else sets up IVs, while another records every vital second. To the untrained eye, it might look chaotic, but in truth, it's organized choreography. These teams practice so often that they move almost instinctively, hardly needing words to communicate. It's this rhythm, this machine-like coordination, that turns minutes into survival and keeps chaos from taking over when life hangs in the balance. Nurses carry emotional weight. This one cuts deep, because behind every calm nurse's face is someone carrying a load you'll never see. They witness it all: the joy of new life, the heartbreak of loss, the chaos of trying to save someone slipping away. One nurse recalled a team desperately trying to revive a 13-month-old pulled from a pool, paramedics rushing, a teenage sibling screaming, the whole room fighting to stay composed while knowing the odds. And still, they had to move on to the next patient, as if nothing had happened. That quiet grief doesn't just disappear, it's called moral injury. The emotional toll of seeing so much pain and being unable to fix it all. Over time, it builds up. Many nurses battle burnout, depression, or worse, but rarely talk about it because of the stigma in their field. So the next time you see a nurse who seems steady and strong, remember, they're human too, carrying memories they wish they could forget. The ER speaks in code. Ever been in a hospital and suddenly heard an announcement like Code Blue or Rapid Response over the speakers? Don't worry. It's not for dramatic effect. Those cryptic words are actually part of a highly organized system meant to alert staff without sending patients into panic. Each code has a specific meaning. Code Blue usually signals that someone is in cardiac arrest, while Code Red often means there's a fire somewhere in the hospital. Rapid Response calls for a team to rush to a patient who's about to crash. These short phrases save time and prevent chaos in already stressful environments. It's worth noting that codes can vary between hospitals, but the goal is always the same: to get the right people to the right place as fast as possible. So if you ever hear a code over the PA, don't panic. It just means the professionals are already on it. Split-second decisions save lives. As terrifying as it sounds, the emergency room doesn't give anyone the luxury of time. Doctors and nurses have to make life or death calls in a matter of seconds. Is the airway blocked? Intubate now. Is that bleeding severe enough for surgery? Call the OR. They always act before it's too late. These decisions aren't guesses. They come from years of training, experience, and at times, pure instinct. Every move is calculated under pressure. Every delay could mean a life lost. This constant demand for immediate action is what makes ER work so intense and so mentally exhausting. The weight of those decisions doesn't disappear when the shift ends either. Many ER staff carry the burden of the choices they made when every second mattered. It's a reminder that saving lives isn't just about skill. It's about courage under fire. The ER never sleeps. If you think hospitals slow down at night, think again. Emergencies don't exactly punch a time card, they just keep coming. When the city sleeps, the ER wakes up to a different kind of chaos. Evenings and Mondays are usually the busiest, while the early mornings offer a brief, uneasy calm. But for nurses and doctors, there's no real rest. They power through endless stretches, skipping meals and ignoring fatigue, because every alarm means someone's fighting for their life. The sad truth is, after those shifts, they go home with more than exhaustion. They carry the weight of what they've seen, the faces, the what-ifs, the losses. That's why burnout hits so hard in emergency care, and why programs to support these caregivers are so crucial. Because when you think about it, these people are the heartbeat of a system that never sleeps. The ER is more than flashing lights and crowded waiting rooms. It's a place of order hidden inside chaos, where secrets unfold every hour. If this gave you a new perspective, hit subscribe and turn on notifications. We'll keep uncovering the hidden worlds of the hospital, from the ICU to surgery to the codes you've never heard of. And remember, while hospitals hold secrets, it's the nurses and doctors who carry the weight of them every single day.